Hi everyone, I'm Zawadi Kimari, a clinical psychologist based in Nairobi, Kenya. I am thrilled, actually, no, I am humbled to be presenting at this Congress. My contribution to this conversation will be titled Finding Strength in Adversity, Thriving with ADHD and Trauma. Well, first of all, the reason that makes me humbled, yet again quite honored to be part of this conversation, is because of the great many men and women that I will be representing through my presentation. And these men and women are the clients that I have served and continue to learn from in the course of my practice. I was not introduced to Dabrowski's works in class or in a workshop or in training or through professionals, but rather in the course of studying some of the things that my clients would continuously bring out to me. So they would ask me questions, they challenge me, they push back, especially when I was being overly diagnostic or stuck in the medical sick model, so that I can move to levels of understanding them beyond the traditional therapeutic models, and now to step more into the light of actually seeing them and understanding them and their experiences as they experience it. And this is how I stumbled upon Dabrowski. All the contributions that I'm going to make today are going to be a totality of lessons that I have learned from them as I navigate the individual adversities alongside them in their journeys and their processes, and as I also bear witness to them finding strength and understanding, and therefore, in general, holistic and psychological growth in life. So, this is my contribution, finding strength through adversity, and I'm going to take us through a number of lessons. So, the first lesson is the concept of being neurotically allergic. Overexcitability or overstimulatability is a unique heightened way of experiencing and responding to environmental stimulus, according to Dabrowski, and this is across five specific areas. So we're talking psychomotor, sensory, intellectual, imaginal, and emotional. And all of these five areas, when you have high levels of over excitability, can easily mimic some symptoms of ADHD and can easily cut across and intersect with some symptoms of ADHD. For example, people who have high levels of psychomotor over excitability tend to also present with, like high levels of hyperactivity and impulsivity, which are hallmark symptoms of hyperactive, impulsive subtypes of ADHD. People with high levels of emotional over excitabilities can sometimes, present with very extreme emotional regulation difficulties, which are also seen amongst individuals who have inattentive type and, a combined type of ADHD. So when someone has overexcitability, and the reason why I call this the concept of being neurotically allergic is because everything that comes from the outside world has the volume turned up a notch higher. So it's not just like, experiencing the world in a very bland way as, a general neurotypical would, but then every single thing that you experience is experienced with a lot more intensity. So, in the words of Dabrowski, overexcitabilities can be a tragic gift, in the sense that one who manifests a given form of overexcitability sees reality way stronger and more multi-sided than the next person. In this sense, then reality ceases to be indifferent and rather affects the person quite deeply, leaving very lasting impressions. Just having that in the background, it can become very, very complicated very, very quickly, especially when adversity and tragedy strikes. But before we get to that, I'll move us to lesson number two, which is the concept of being misunderstood. And this is historically the story of all gifted and neurodivergent people, cutting across from, you know, autism spectrum disorders into attention deficit hyperactivity disorders. So all forms of neurodivergence can really relate to the concept of being misunderstood, because more often than not, especially in the context where I practice in Kenya and in Africa, some parts, other parts of the world, when you have ADHD, or when you are neurodivergent, or when you are highly gifted, then it would be very difficult for the next person to be able to understand the experiences. Now, when you add these components of being misunderstood, and here I'm going to talk a little bit about especially a child or an adult who has ADHD. In Kenya, for the longest time, especially when I was growing up, which is not very, very long ago, children who are highly hyperactive, so people who would have difficulties in concentration, people who would be easily forgetful, they would be mislabeled and misattributed that these, traits or these tendencies were just their personality and how they were wired. So no one would ever make any attempt to try to understand why or what was going on. Rather, it would always be a situation of there's something wrong with this person, and no one would try to understand that. No one would try to understand, what is going on with this person. Rather, they would just label that's their personality, that's who they are. They're lazy, they can't settle down, they're stubborn, they're arrogant, and all of these other big labels that used to be used. And back in the day, then the remedies for that would be, discipline. And here I'm talking about corporal punishment, beatings, spanking, as a way to just make the person change. And therefore, that created a lot of misunderstanding, especially among now people who would be around my age who went through these things growing up. Of course, then you have very, very shifted sense of self, or like the concept of yourself is very, very jaded because of these experiences. Now, when the person has also tendencies of excitability, then the environment can be very, very overwhelming. Now, if you couple of excitability like that, and then with all of this being misunderstood, being mislabeled, misattributed, misconstrued, and the limited to no understanding of these concepts, like of neurodivergence, overexcitability, and all of these other big broad things, then the person can easily get very, very uncomfortable, and in turn then that results in a lot of emotional distress and discomfort. Now, many people stay in a state of trying, very, very intensely and very diligently, and with lots of determination to adapt to the rules and expectations of society, what Dabrowski terms as the primary level of disintegration. And sometimes you can stay in that primary level of disintegration for a very long time. But then, because some of these things are a little bit way beyond you, then over time you do move into different other dynamisms. And especially for me, working with my clients, just having that understanding of dynamism in the concept of being misunderstood was a very big take home for me, because then I would sometimes orchestrate for them to move from one level of dynamism into another level of dynamism, with the hope that they would eventually reach to the highest level of dynamism, which is level 5. Now, in the face of great anxiety and adversity, then of course any human being would generally react and respond. And some of these responses take the form of psychoneurotic symptoms. Now, at this point, I have to make a very big point of clarification, and that is psychological and post traumatic growth, the totality of the processes that happen as an individual trying to find their footing into coping, and not the trauma, which is to say that when adversity strikes, the pain and distress that come along with it is not to be overlooked, so that one can find strength. And we're not supposed to dial down our empathy or our clinical acumen or all of the things that we need to do to facilitate for someone to, find footing and bearing and alleviate some of the pain and distress and discomfort that comes about with adversity and crisis, but rather so that, like, the totality of all of this is so that one can find strength, gradually getting to the point of triggering some level of dynamism and therefore facilitating for holistic growth. Another point that I need to make here for clarification, especially in line of my contribution to this conversation, is that trauma is not necessary for growth to happen. Growth, people have capacity to develop and grow despite and in spite of adversity. So you don't really have to experience difficult situations for you to be able to progress. Progression can happen with or without adversity. And now with this, then we're going to move into the next lesson towards growth. And this, my lesson number 3, is the path of many roads and many destinations. So when adversity and tragedy strikes, all human beings are stretched to a point of what I like to see as metamorphosis of sorts, because through this process, then it sort of facilitates dynamism and growth towards your true self. Sometimes this does not happen. Sometimes it doesn't happen like this. Sometimes there are people who will actually move into positions of development and progression post adversity, which in other schools of thought can be termed as post-traumatic growth. There are people who are very resilient, and even when tragedy strikes, then their resilient factors and other factors surrounding that then allow for them to buoyancy through crisis situation and adversity without a lot of psychological distress. I mean, it is a fact that in spite of around 70% of people experiencing very traumatic circumstances, not all of them end up developing post-traumatic stress disorder or any other stress or trauma-related disorders. Nevertheless, more often than not, when adversity comes with all of this stretching that occurs, like from a psychological point of view, it will come with significant distress and anguish. And sometimes the level of anguish that comes in goes into, clinical levels of presentation. And sometimes it is within the subclinical threshold. But what I want to highlight here is that even when someone is going through, like these very painful processes, sometimes it is necessary to allow the person to go through the processes in a way that then will allow them to eventually morph into, psychological and holistic growth. And over here, then I am reminded of the animation show Inside Out, which wherein it took embracing sadness to help Riley find the help she needed before she was now able to gear up and move and actually now find a way to seek help and reprieve from a lot of the things that were going on with her. So therefore, embracing discomfort and change actually gears one into the more authentic and unique personalities. So on this point, a lot of my clients take very different paths, and all of these different paths takes them to different destinations depending on their processes. So the path that they take is a path that suits them best. Some will incorporate having medication and therapy, some will do therapy alone, some will do therapy alone, and some will actually not utilize regular therapy or medication for one reason or another. Again, now for me, this becomes another humbling learning point for me, that as a practitioner, the journey and the processes that individuals go through are not mine. I am not the architect. Rather, the individual has agency to determine their path. And equally, the path is not linear, but a very long motion that is occurring. So long as the motion is going forward, and sometimes even there's no motion whatsoever, but then so long as you're not back moving, then that is success. And that's also something else that I learned again also from Dabrowski's theory of positive disintegration, that you can move across these dynamisms, different levels of dynamisms. And just because you're morphing around between, one level to another and another before you hit to the, the final fifth level of, positive disintegration and dynamism, then it doesn't necessarily mean that you're not you're not being successful. Something else that I also need to mention at this point of, different paths and different destinations is that even in the face of adversity, different people will respond differently to different things and different treatments and different interventions. But then at the end of the day, when the client, when the patient, when the individual, when the gentleman or the gentle lady is gets a lot of facilitation towards the path that suits them best, then a lot of growth and, lots of positive development and progression then can occur. One of the biggest challenges that many divergence experience in the course of therapy is that they're more often than not misunderstood generally. Generally. And I also would fall under, you know, people who generally misunderstand sometimes the people that I work with. And that in itself is very psychologically and emotionally distressful. And it becomes only an heightened further and agitated or aggravated further when tragedy strikes. Because one of the main symptoms of adversities and crisis situation is that more often than not, the individual may feel like it is their fault, that your reactions mean that you're broken, that you must find a pathway or a way to be fine and function despite and in spite of all of the emotions that you're going through. And that in itself can be a big stumbling block, especially for someone who is trying to move into better and more developed versions of their true self. Because you see, when you feel misunderstood, it already sets the precedence that possibly you are not doing the things the way you should be, that possibly you are actually flawed, that possibly there is something wrong with you. And now when tragedy strikes, which here I'm going to just go on a little bit of a caveat, people who have ADHD sometimes experience a little bit more of traumatic experiences than, like the neurotypicals. And this could be because of, being misunderstood in the environment, the difficulties that come about with executive functioning, existing in an already very overly stimulating environment, which in itself can be very, very stressful. So having that in the backdrop, and then now, something happens to you, it's very easy to again just, internalize all of these things, internalize the guilt and the shame and a lot of the faults and the flaws, and think that it is your fault, that you're the one who made all of this happen. Now, that takes us to our next lesson, which is the lesson of the emerging phoenix. Now, whereas dynamisms and trauma and growth are very separate things and very separate concepts altogether, but through the work that I have been able to read around through and have been able to be directed both now by my clients and, just opening myself up into the whole theory of positive disintegration, and having lots of understanding of dynamisms in processing trauma, one can find a pathway out of adversity into a new normal. And the new normal encompasses a lot of changes in the perception of yourself, the perception towards the environment, and perception towards, you know, everyone else in totality. The understanding of excitabilities affirms the challenges as experienced by these gifted people in a very, very typical world. And here I'd like sometimes to cross refer between dynamisms and one of the measures of post traumatic growth, even in situations whereby one didn't go through a big T kind of trauma, but then when I juxtapose between these two concepts, so the concepts of dynamisms and the concepts that surround psychological post traumatic growth, then I find a lot of synergy from both of these schools of thought and these bodies of knowledge. Because post traumatic growth, especially when I eventually take my clients through an evaluation to see whether they have attained levels of positive disintegration and morphed into, new truer levels of self, encompasses 5 domains. So the first domain is the perceived changes in self, becoming stronger, becoming more confident, more assertive, more grounded, developing very strong internal values, internal locus of control. The second one is developing closer relationships with family and friends, fellow trauma survivors, and even strangers, having higher levels and more holistic levels of empathy and how to work with that empathy. The fourth one is changing lives, philosophies, and existential awareness of the things that surround you. Fourth one is changing in priorities, and finally changing in spiritual belief patterns, more enhanced and in-depth spiritual foundations and background. And it is from here that I grow lots and lots of overlaps, especially useful in practice. And a lot of these parallels then help facilitate for, especially for in the case of a practitioner, whereby I can then integrate Dabrowski's theory of positive disintegration into day-to-day practice of trauma management and trauma care with the clients that I serve. And the more that I learn about these concepts, and the more that I draw parallels and synergy from both of these, as well as the different overlaps and, like all of the different similarities, then I find that my clients grow more and more from one level of dynamism into another level of dynamism into another level of dynamism, and gradually over time then they're able to move into a very holistic and wholesome sense of self. Now, at this point here, then I would like to just encourage any other practitioner who's out there, especially because from a clinical psychologist point of view, a lot of the work that we do is very stuck on the medical model. But then when you understand different levels of human beings and interactions, and not just for the gifted but for all individuals, not just the neurodivergence but also for neurotypicals, the Dabrowski's theory is very, very powerful. It's a very powerful adjunct to every other treatment modality that you have out there, cutting across from CBT, DBT, EMDR, trauma therapies. When you're able to inject aspects of this concept in your day-to-day practice, it can really enrich and enhance your clinical practice with your clients, especially towards helping them have better understanding of themselves and their realities, and allowing them to come up with different forms of, their own awareness and the awareness of the environments that they exist in. So it is with these very many remarks that I would like again to thank thank everyone. I'd like to thank the Dabrowski's Congress for allowing me to be of the panelists for this. And I once again would like to acknowledge my clients and my colleagues with whom we do a lot of back and forth to come up with more holistic and integrated interventions for the people that we serve. So thank you, and continue having yourselves a wonderful conference. Thank you very much.